statement.
And thank you, Chairman Roy and Ms. Scanlon, for convening us today. I was psyched to learn that we were having a hearing about, quote, legislative reforms aimed at protecting minors. I thought we were going to get together to oppose Donald Trump's threat to health care for 37 million children who rely on Medicaid and the CHIP program. After all, they want to cut $885 billion from it. Alas, that's not on the agenda. I thought maybe we'd come together to stop Trump from cutting benefits for 15 million children who rely on SNAP benefits to get the nutrition they need in America. Or perhaps we could be opposing the gutting of the Department of Education, which ensures 26 million low-income students and 7.5 million students with disabilities get access to real educational opportunities. We could stand together really for children, but no such luck. Instead, we're here to talk about Dr. Haim, a man who, according to a May 2024 criminal indictment returned by a unanimous grand jury of citizens in Texas, unlawfully obtained and disclosed the medical records of children in violation of HIPAA, a law Congress passed in 1996 to establish standards protecting health information from disclosure without the consent of the patient. According to this criminal indictment, Dr. Haim, quote, obtained personal information, including patient names, treatment codes, dates of service, and attending physicians from Texas Children's Hospital's electronic system without authorization, and under the false pretenses that he needed the access for the provision of medical services to patients under his care. He lied. They were not under his care. He lied to get access to the medical records of 4 adolescents who were not his patients. And what did he do with those patient medical records? Did he go to the Department of Social Services as instructed by law? Did he go to the police? He thought they were in danger of child abuse. No. He went to Christopher Rufo, a right-wing conservative activist and provocateur, to put them out into the media. Now, Dr. Haim claims he did this, and my colleagues, alas, are celebrating him for this because he believes that the gender-affirming care these patients were receiving from licensed physicians was, quote, child abuse under Texas law. Now, if he truly believed he had evidence of child abuse, Dr. Haim knew he had many avenues to report it by going to a public health authority or the Department of Social Services or the police. As his criminal indictment states, as a Baylor University medical resident, he received, quote, extensive HIPAA training, that he attended numerous trainings where he was provided information related to anonymous reporting of any instances of child abuse, misconduct, or ethics violations. The HIPAA implementing regulation specifically authorizes disclosure to, quote, a public health authority or any other appropriate government authority authorized by law to receive reports of child abuse or child neglect. Yet after obtaining unauthorized, individually, personally identifiable health information from young people who were not his patients, Dr. Haim made no attempt to report any concerns through any of the authorized government channels, to his supervisors or to his employer's anonymous hotline, to the police or to Child Protective Services as directed by his training and mandated by Texas law. Instead, he went to a right-wing culture warrior whose recent articles have been titled, "There's a Trans Cult Inside the NSA and the NSA's Secret Sex Chats." Now let's be clear that the gender-affirming care that Texas Children's Hospital was providing was not child abuse. All major medical associations agreed that evidence-based gender-affirming care is necessary, and in some instances, it's life-saving for transgender youth. That care was also legal at the time the hospital provided it to adolescent patients whose medical privacy Dr. Haim violated. Only later did the legislature pass its ban on these practices. But with all due respect, Dr. Haim makes a very strange whistleblower. He's a doctor who fraudulently obtained the medical records of youth who were not his patients, not under his care, and then he used them for blatantly political and ideological purposes to make a splash and a name for himself as an anti-trans crusader. And he's got every right to do it, but he doesn't have a right to violate other people's privacy and violate HIPAA. Now, I know what my colleagues think of people who leak sensitive personal information. Take the case of the former IRS contractor who exposed the tax avoidance practices of billionaires, including Donald Trump, by disclosing thousands of returns to news groups. That contractor was prosecuted, and he received a 5-year prison sentence. He had no pardon. Yet, Chairman Jordan has opened an investigation because he thinks that 5-year sentence was not enough. He thought it was far too lenient. But now he wants to lionize and valorize Dr. Haim. Why? My colleagues want to uphold Dr. Haim as some kind of moral role model and exemplar. So let's take his example to its logical conclusion. If it's going to be fine now to steal other children's private healthcare information and turn it over to the media if they believe the child's being harmed, and despite the fact that the law provides an authorized way to do it. So say I'm a doctor in Texas, and I know that the law requires you to get a vaccine for measles. The kids have got to be vaccinated. And I overhear a colleague of mine saying that multiple patients whose parents don't believe in vaccinating their children are not being vaccinated. And so I try to talk to that doctor. That doctor says, everything is fine, leave it alone. Now I suspect child abuse, but I don't go to the Department of Social Services, I don't go to the police. No, I break into the computer system, or I convince someone I really have authority to get in the computer system, and I take their records, and then I go to show not the Department of Social Services, not the police, not a health authority, but I go to a media outlet. I go to pro-vaccine organizations, and I say, release this information on that family. Those parents are not letting their kids get vaccinated. And I'm going to be a hero. I'm going to be a whistleblower, even though I'm not following the law. Are my colleagues okay with that? I'm fascinated to know. I know I've got some libertarian colleagues there. The distinguished gentleman from Kentucky, would he be fine? Would he be lionizing somebody who breaks into a computer system to get other parents' children's vaccination information to release it because I think it's child abuse not to vaccinate kids for measles? And by the way, I do think it's child abuse in Texas today with an outbreak of measles where children are dying not to have your children vaccinated. But I would never break the law and violate that family's HIPAA rights and those patients' HIPAA rights by stealing it and turning it over to a public interest group and to the media. And this is where we are today. So please act like the Judiciary Committee. Follow through on the logic of what it is you're saying. This is not a whistleblower we're dealing with. It is a law violator. We should be here talking about what we can really do to help children instead of plunging everybody into this exercise in absolute moral hypocrisy. Thank you, Mr. Chairman. I yield back.